If you're still in pain, despite doing all the things they say should work, and you're anything like the women that I work with, you might feel like something critical is being missed, right? Doctors dismiss you. They'll tell you there's nothing more we can do. They'll tell you to learn to live with pain as your new normal. But what they won't tell you is that 1 in 5 women have overactive pain pathways, which is the reason why nothing ever works and pain sticks around for far too long. And so today I'm breaking down the 7 warning signs that your pain pathways are overactive, what that actually means for you, and most importantly, how this deeper understanding could finally change everything. Because let's be honest, when the real issue is overlooked, relief remains out of reach. Now, if this is your first time listening, welcome. I'm Dr. Alissa Wolfe. I specialize in complex and persistent pain, and I'm the founder of the chronic pain breakup method. And let me tell you, it blows my mind how most women have never even been told about this, about overactive pain pathways. It blows my mind that so many women have had to suffer for many months, many years, decades even, and no one ever told them this. It breaks my heart. It totally breaks my heart. What I've seen is that I've seen women getting passed around from doctor to doctor, being dismissed. They were being blamed for their pain when treatments didn't work. They weren't being given any explanations as to why they had so much pain. That, or they were getting conflicting explanations and vague advice. And quite frankly, it's unacceptable. Okay, with all due respect to the medical system, it's unacceptable the way that we treat pain. The medical system treats all pain the same, and it isn't. Looking back, I feel so ashamed of my profession, ashamed of the way that the healthcare system goes about handling cases like this. It's not evidence-based care. And to put it bluntly, the healthcare system is 15, 20 years behind the research, probably more. Providers are treating all pain the same. And when you don't fit their cookie cutter mold, they just look the other way. And the women I work with, they refuse to believe that it's truly all in their head. Deep down, they know it wasn't just stress or anxiety. They felt like there had to be something more going on. And deep down, they were worried that something critical was being missed. And what no one ever told them was that missing piece could be that this whole time they had overactive pain pathways. Their pain system had become hypersensitive, like someone cranked the volume up to 11. It didn't matter where their pain was or how it started, the diagnostic label didn't matter because the underlying mechanism involved those pain pathways becoming overactive. And listen, this isn't a mindset thing, right? This isn't imaginary. This is a well-documented adaptation of the pain system. Those pain pathways become overactive. And when the pain system becomes hypersensitive, we need to approach things differently. And no, you're not just going to think your way out of pain. Okay. The medical system likes to treat all pain the same, and it isn't. This kind of pain is different and requires a different approach because no amount of stretching, adjusting, meditating, or medicating or anti-inflammatories, right, is going to fix the issue. This is exactly how it was for my client. She had pain for 8 years. She did everything her doctors recommended. She even had surgeries. They fused her spine, but nothing worked. Not even the spinal fusion took away her pain. She felt like her doctors were guessing. She felt like a guinea pig, like a test subject. But eventually we started working together on her overactive pain pathways. And in just a few weeks, she doubled her activity tolerance. She would expect the pain to come, and it never did. She was able to do things on her no list. And quite frankly, she was shocked. She couldn't believe it. And she was pissed at the same time that it took her 8 years. And no one had ever explained this to her before. So let's get into it. How do you know if this is what's happening for you? How do you know if you have overactive pain pathways? And so I'm going to go through some of the warning signs that could indicate that your pain pathways are overactive. But before I do, and this is important, you don't have to have all of these signs to still have overactive pain pathways. Okay, this isn't an all or nothing list of diagnostic criteria. You don't have to check all the boxes, right? You could have 1 or 2 of the things on this list and still have overactive pain pathways. Okay, so we're not going to say, oh, that's not me. Okay, I don't have overactive pain pathways because I only had 6 out of the 7 or whatever, right? because this isn't black or white. Every body presents differently, right? Not everyone's symptoms are identical. So we're going to keep an open mind, right? This isn't a magic formula or diagnostic criteria. I don't want to get on a call with you later on and you tell me, but Alissa, I don't think I have overactive pain pathways because I didn't have all the warning signs you mentioned. And that's the thing. When I do those calls, when I'm on a call with someone, I'm asking them to share their history, share their symptoms, the things that they've tried. These are the kinds of things that I'm looking for, the things that I'm talking about today, the signs that I'm looking for, because I want to help you give clarity on whether overactive pain pathways could be contributing to your pain. Because if it is, then I'm going to recommend a plan to address that. So, how do you know if you have overactive pain pathways? Let's get into it. Okay. The 7 warning signs your pain pathways are overactive. Okay. Number 1, you still have pain that has lasted for longer than 6 months that won't go away despite trying everything. That is what I call stubborn pain. It sticks around for the long haul. It doesn't want to budge despite doing all the right things. And maybe your doctors are stumped. Maybe they think your case is a total mystery. Maybe they've said, there's nothing more we can do. Maybe they think your pain is all in your head because it doesn't make sense why you still have pain after doing all the treatments that should work. For many of my clients, they're still searching for an explanation because their MRIs and their tests can't really explain their symptoms. And also, many of my clients do have physical issues. Many of my clients have had serious injuries, right? Nerve damage, multiple surgeries, scar tissue, scoliosis, disc herniations, bone spurs. Okay. It's really easy for us to overlook those overactive pain pathways when you have physical stuff, when you have tissue damage. But what I've seen is that folks will try for years, right? Years, decades to fix the physical issues, and they still have pain. And that's because the surgeries, the ablations, the injections, the physical therapy, the chiropractic doesn't address overactive pain pathways. So, regardless of whether you have serious structural issues or tissue damage or not, okay, if you've had pain for longer than 6 months and you've tried the standard treatment methods and your pain isn't responding, what do you think that is? Those conventional treatment methods don't address the overactive pain pathways. This is huge. This is huge because I could literally stop the list right here at number 1 because most of the time, that's all I need to know to be able to say, yep, you have overactive pain pathways. Because it's really not possible for us to have pain for that long and to not have overactive pain pathways, especially if the pain isn't responding to typical treatment interventions, right? And I'm positive actually, that if you've had pain for a long while, you've tried all the things and you're now beating yourself up over it, right? Because it's like, what am I doing wrong? What am I missing? Maybe I'm not trying hard enough. And no, in fact, you're trying so hard, but it's not your fault that the things you're trying aren't addressing what's really going on underneath the surface, what we can't see in your pain system. Like we can't see this kind of thing on x-rays or MRIs. We can't even see this with a nerve conduction study. But if you have stubborn pain, regardless of how it started, where it is, or what your diagnosis is, you can have overactive pain pathways. Okay. This is the strongest indicating factor on this entire list. And everything else that I'm about to mention is kind of like checking the box, like further validating that that's what's actually happening, that this is overactive pain pathways. Make sense? Okay, so number 2, your pain is unpredictable. It spikes unexpectedly. It feels like it has a mind of its own. Sometimes it's like, it comes on out of nowhere and it has you suddenly questioning, what did I do? What did I do wrong? I don't know what I did. And no matter how much you track your symptoms, right, you can't necessarily identify any consistent triggers, right? The pain is inconsistent. You never know what you're going to get. Wake up in the morning and it's total crapshoot. It's inconsistent, right? Some days you can climb that flight of stairs and be fine, and other days you can climb the same flight of stairs and it's like, what the hell, right? And can we just say how insanely terrifying that is? Like, I just want to acknowledge just how scary it would be to never know when the pain is going to get worse, when it's going to hit you. Like, if that's me, I'd feel so on edge. I'd feel so tense and like guarded. and probably overly cautious because it's like, I'd have no idea what's going to make the pain worse. So I'd be afraid to do practically anything. If the pain is totally random, then it's like you feel like you have no control, which for us perfectionists and control freaks is a total nightmare. And so it feels like you have to walk around on eggshells because of it. It's awful, right? So that's number two. Okay. So if your pain is inconsistent, it's random, it's unpredictable, and it feels like you have no control, this again is a really big indication that you could have overactive pain pathways. Now, number three, your pain seems over the top. The level of pain you feel is way out of proportion to what triggered it, right? So, for example, I've had clients where they had a disc bulge. There was some foraminal narrowing, but the doctors explained that the pain experienced could not be explained by this. The doctors explained that people can have the same thing on their MRI and have no pain at all. So it didn't make sense that this was causing this much pain. I've had other clients who would have pain really bad after simple things like rolling over in bed. Like that shouldn't cause that much pain. It's so frustrating. It's like, what the heck? I barely moved. And I've even had clients who feel pain with wearing certain clothes, pain with being touched, where it's like everything is so sensitive. Even the bed sheet touching the skin is painful. And for all you science nerds out there, we call this hyperalgesia and allodynia, but it's this amplified or disproportionate pain response. The pain is more intense relative to what's causing it. This is an extremely strong indicator for overactive pain pathways. Now, number four, some of you will have pain that moves around. It migrates, where your pain is not just limited to one spot. Now, this isn't always true for everybody. So if your pain is only in one localized area, cool. You might still have some other indicating factors. But for a lot of people, for a lot of the clients I work with, they have multiple areas that hurt. For some, that means their pain actually jumps around and they're left kind of chasing the pain from one area to the next, driving their physical therapist crazy. And for some, it means they just have multiple painful areas. Maybe they get back pain and headaches and foot pain. And sometimes the pain is widespread, head to toe. And other times it can start in one area and begin to spread. Like, for example, a client of mine had knee pain that progressed gradually to the whole leg, up to the hip and back, and eventually started having similar symptoms on the opposite leg. These are pretty good indications that you might have overactive pain pathways. And here's the thing, we might not want to chase the pain because having overactive pain pathways is actually a more systemic issue. It affects the whole body, not just one area. Which reminds me, I had some clients who like to say, for example, my back pain is overactive pain pathways, but my frozen shoulder is a frozen shoulder. That's structural. Like that's a structural issue, not pain pathways. But you can't actually separate the two entirely, right? Because this is an issue within the pain system itself, which impacts the whole body. So that shoulder, while we know that it has some tissue damage, some mechanical factors, some physical stuff is going on, definitely, it's very likely that the overactive pain pathways are still contributing to some extent, okay? So, number four, pain that spreads or moves around. Number five, you get strange sensations that don't necessarily make sense, right? So maybe you feel sensations like burning, tingling, cramping, heaviness, creepy crawlies, or buzzing. Sensations that don't make sense to your doctors. And when you try to explain it, they look at you like you're crazy. You're not crazy, okay? You have overactive pain pathways. And guess what? Your nerves can become sensitive. They're firing like crazy, and the brain is getting bombarded with these signals, and it can't keep up. So it tries to make sense of it all. And so it creates these sensations, the zings, the itchiness, even swelling for no apparent reason. Okay. If you experience anything like this, it's a very good indication that you have overactive pain pathways. Make sense? Okay. Number six, sleep feels impossible. Again, this isn't always true for everybody. Some lucky folks don't struggle with sleep as much. But in my experience, sleep is a pretty big problem for most. And it's like, no matter how exhausted you are, you're unable to sleep. And when you do sleep, you're not getting quality sleep. You're still waking up feeling exhausted. At night, you're tossing and turning. You can't fall asleep. You can't stay asleep. Some of my clients wake up at like 2 or 3 a.m. and it's impossible to fall back asleep. This is quite common. So if your sleep feels like shit, it could be that you have overactive pain pathways. And this actually ties in with number seven. Number seven is you have other seemingly unrelated symptoms. You have no energy. Your mind is cloudy. Do you have fatigue and brain fog that makes it difficult to focus and think clearly and make decisions or stay motivated? Maybe your memory is shit. Like you can't walk into a room without forgetting why you're there. You're struggling to find your words. You could lose your train of thought mid-sentence. But what's weird, what's really weird, right, is that you have this fog and this fatigue, but you're totally on edge at the same time. You're wired but tired, because that's how it feels, right? And here's the thing, when you have overactive pain pathways, your brain is running on all cylinders. It's trying to process what's going on in your body. Pain is literally taking up brain bandwidth. Those brain cells are preoccupied with pain. So it's no wonder why you can't remember everything. It's no wonder why you feel so ADHD, why you can't focus, why you're too tired to get anything done, and why you can't seem to make decisions. Honestly, it's no wonder why you're so irritable. Your brain is running on full speed. It's working so hard. You literally won't have the bandwidth for much else. Can you see that? Okay. Is your gut a mess? Do you get uncomfortable gut symptoms, bloating, constipation, diarrhea, IBS? Yes. Do your hormones feel like they're out of whack? Do you get headaches? It all makes sense. Now, let me be really clear. Having overactive pain pathways doesn't mean your pain is all in your head. It means your pain system is amplifying and prolonging the pain response beyond what's actually necessary. And this is the reason why some people recover quickly from an injury, while others who had the same injury end up with that pain that lingers for months or years. That's because their pain system has become hypersensitive. So, yes, you may have had a disc bulge or nerve damage or surgery, but if your pain isn't responding to the usual treatments, that tells us something deeper is going on. So now, just to review, you might have overactive pain pathways if, number one, you have longstanding stubborn pain that persists despite doing all the quote right things. Okay. Number two, your pain is unpredictable, inconsistent. Three, the pain is over the top, disproportionate to the size of the trigger. Four, your pain spreads or migrates. Five, you get strange sensations. Six, you have sleep issues. And number seven, you get other uncomfortable symptoms, brain fog, fatigue, gut issues. And again, I can't say this enough. You don't have to have all seven of these. For instance, some clients might only notice unpredictability and exaggerated responses and might not have issues with sleep, while others might deal with widespread pain and fatigue. It's not about needing to check every single box. It's about identifying the clues. Okay, but if you're still struggling with pain after trying all the conventional treatments they say should help you, it could be that your pain pathways are overactive. Okay, it's not purely physical, right? Because otherwise, the injections and the physical therapy and the chiropractic adjustments and surgeries would work. Yeah, it's not all in your head because the mind over matter wishful thinking, the pain reprocessing therapies and somatic tracking and meditation, digging up repressed emotions, all of that would produce lasting relief, but it doesn't. And it's not inflammation, okay? Otherwise, the anti-inflammatory medications and creams and injections would work. Okay, if you have long-standing stubborn pain, the reason why none of these treatments work is because you have overactive pain pathways. Does the pain change with changes in the weather or stress? That is what happens when you have overactive pain pathways. Okay. Are you sensitive to touch or pressure? Sensitive to everything? Sound, even? It isn't a coincidence that you have all these issues, all these symptoms. That is what happens when your pain system is hypersensitive. And quite frankly, we need to stop treating all of these individual symptoms separately because that isn't evidence-based care because they're all connected to overactive pain pathways. Are your doctors just stumped? They've given up, right? They're running you around in circles and it feels like they're just guessing. Or maybe you're still trying to figure it out and get more extensive testing and second opinions, and you're exhausted and overwhelmed by feeling like you're missing something and your doctors are missing something. Well, friend, I'd say this is what they're missing. Our medical system, with all due respect to our doctors and our providers, because I do believe that most of them do care, but the medical system just hasn't caught up to the research. Doctors aren't taught the latest advancements in pain research. Even the specialists, right? The neurologists and pain management doctors, you can't just get this information from your doctors. This is a huge problem. And this is the reason why they tell you to learn to live with it. This is the reason why they say there's nothing more we can do, because they're still treating all pain the same when it's not. That's not evidence-based care. Saying there's nothing more we can do, learn to live with it, is not an evidence-based statement. And I know you might feel like it's true that you've tried everything. It makes sense to me if you feel like your hope is wearing thin. You're scared that nothing will ever work. And quite frankly, it makes sense to me if you're skeptical of trying anything new. I know, I'm sure you've already spent so much time, money, and energy on different treatments, and you feel so guilty about it. And it's hard to get your hopes up again because, what if this is just another thing that doesn't work? You can't handle another disappointment. Honestly, you've been through so much. So it's not that you need to try harder because you've been trying so hard, but it's not that you need to work harder. You need to work smarter. It's completely reasonable to be skeptical. But at the end of the day, the reason nothing has ever worked is because the conventional treatments and even the alternative therapies, even the mind body methods that help you regulate your nervous system or the vagus nerve activation, or seriously, even the sympathetic nerve blocks, they don't directly address the overactive pain pathways. We need to stop treating all pain the same when it's not, because that's not evidence-based care. This is why in the chronic pain breakup method, we take a very systematic step-by-step approach to address those overactive pain pathways specifically. That's the focus. My clients walk through my proven protocol where they learn to not just manage pain when it gets bad, but learn to prevent pain flares and big spikes in pain. They learn to optimize their activity tolerance by pushing to it and not through it, which weakens those hardwired pain pathways over time. They layer in customized strategies that lower the sensitivity of targeted nerves and strategies that improve sensory and tactile processing, which is important for lowering the overall sensitivity of the pain system. And then they learn to incorporate stretching and strengthening again, doing exercises again in a way that actually takes into consideration that their pain system is sensitive. So if you've been listening today, you're recognizing these warning signs in yourself, wondering why no one has ever explained this to you before, then I want you to know it's not your fault. Okay, no one ever told this to you before. No one ever showed you that there was more that you can do. But you don't have to keep spinning your wheels and guessing and feeling like a test subject and hoping that something sticks. And you don't have to figure out how to address this all on your own. I've helped hundreds of women with some of the most complex and persistent pain conditions, women who thought they'd tried everything but were desperate not to give up. A client of mine just this last week sent me a video of her deadlifting 95 pounds when not that long ago she was terrified to even lift just 10 pounds. Okay. Another client who had pain for 15 years, she had 7 surgeries and even a CRPS diagnosis, is now going on walks whenever she wants. She's enjoying traveling. She's having more and more pain-free days, something she never thought was possible. An experience she described as surreal because she had forgotten what it was like to not be in pain all the time. So if you want to know more about the chronic pain breakup method, then I want to invite you to book a free pain care call. All it is a free conversation over the phone. We'll go over your symptoms, your history, and then I'll help you map out a plan for how you can relieve your pain, get more active again without paying for it in pain. And I'll go over how I can help you implement that plan that directly targets those overactive pain pathways. So be sure to book your call now before my schedule fills up, before you get distracted and forget. I'll leave the link in the description. I really hope that you found this helpful today, that you found some clarity and some new insights and a new direction to take in your pain care journey. That's all for now. I'll see you next time.